Thank you so much. So I'm going to talk about ocular blood flow measurement techniques, and I'm associate professor at GSVM Medical College, Kanpur. Now, when we see this chart, we do understand that there are a variety of techniques which can be used for blood flow measurement. They can be non-invasive techniques, they can be invasive techniques, and then we have two latest techniques which have come up. Now, when we talk about non-invasive technique, laser is one modality which can be done in the form of laser Doppler velocimetry, laser Doppler flowmetry, and laser speckle technique. Then we have color Doppler imaging, which is widely used technology because machines are widely available at various centers. And it is used for doing color Doppler in carotids also, and therefore we can utilize this machine. So I will be discussing in detail about color Doppler imaging. Then we have other modalities like retinal vessel analyzer, retinal oximetry, blue field and Topic technique, and pulsatile ocular blood flow. Besides this, we have invasive technique in which scanning laser ophthalmoscopic angiography is done with the help of fluorescein dye or Icg dye. And then we have latest of the two technology, which are Doppler, Fourier domain, OCT, and OCT angiography. Now let's talk about color Doppler imaging. As I said, it is widely used technology because being non-invasive and machine being easily available. So what is the principle which is being used? It is an ultrasound technique which uses Doppler shift of the frequency and therefore measures the blood velocity. Now, where the blood flow velocity are measured, as Vinita told very nicely, we measure primarily in the three arteries, which are ophthalmic artery, central retinal artery, and short posterior ciliary arteries. Now, let's locate them on this B scan photograph. We saw just now in the figure as Dr. Vinita shown it. Now here, first of all, we need to focus this optic nerve head. Like here we can see the optic nerve head. The anterior part of the optic nerve has the central retinal artery, which is imaged as close as possible, as anterior as possible. These two are the location of tufts of short posterior ciliary artery, and ophthalmic artery is seen in association with recti muscle almost 4 millimeter behind the globe. Now here we can see central retinal artery. Now once we image the artery, we apply Doppler flow to it, and then the top of the graph is shown as peak systolic velocity, the top of the graph is shown as end diastolic velocity, and resistivity index is automatically calculated by machine. The best part is that these blood flow velocities are reproducible, and various studies they are there to prove this. Now, whenever we are doing color Doppler imaging, we make the patient to lie supine, and then we apply the ultrasound probe, the Doppler probe, as we do for our B-scan ultrasonography. Now, let's see this small video that how we need to do it. As I said, we need to focus on the optic nerve head like here, and then we put this Doppler window, and we can see the pulsatility of the flow in the anterior part of the central retinal artery. Here is the short posterior ciliary artery, and here is the ophthalmic artery. So one by one, we put, now this is central retinal artery, this is short posterior ciliary artery, and this is ophthalmic artery. It is important to identify these pulsations and put the sample cursor. And as you put, you can see this pulsatile graph coming, and then you can measure with the inbuilt caliper inside the machine. Now here, this is venous flow. So don't get confused. If it is non-pulsatile flow, it is a venous flow. Here we are imaging the ophthalmic artery. It is in close association with some recti muscle, and therefore you can identify the recti muscle. This is the recti muscle. You need to change the direction of the cursor to perpendicular to the blood flow to get accurate readings. And here you can see so this is method. You can use another radiologist who can use this. Am I audible?
Yes,
yes,
ma'am.
Yes, you're audible, Shalini.
Okay, fine. So we can ask some of our radiologists to do this, or else what we can do is that we can train ourselves also to do this technology. So these are the various interpretations which can be done on this color Doppler imaging. Sometimes velocity might be absent. Like recently we did in a case of mucormycosis, and here we can see it was very difficult to identify any of the structures. And although we could identify the optic nerve, but still no flow was present. So in occlusive disease, velocity is absent. You can have increased peak systolic velocity where vessels are narrow at the measurement site. So we did our study in our subset of patients of primary open-angle glaucoma, angle closure glaucoma, and controls. And we find that colored of ocular blood flow parameters are reduced in the patient of primary open-angle glaucoma, also in PACG, but they were more reduced in the patients of open-angle glaucoma. This is another study which we recently published, the effect of Valsalva maneuver on glaucoma patients, where we found that when Valsalva was being done, there was reduction in peak systolic velocity and end diastolic velocity, and there was increase in resistivity index of the ocular blood flow. Now, we discussed about various pros of the color Doppler imaging, but there are cons which are associated with it. The velocity is detected, but not the actual blood flow because it cannot measure the actual diameter. A trained person is essential to get reproducible reading, which can be done with practice. Now coming to another modality which is available at few of the centers, laser Doppler velocimetry. Now here it is a non-invasive technique which is based on Poiseuille's principle and Doppler effect. Because vessel is eliminated with the help of a coherent laser beam, therefore actual blood flow parameters can be measured. But because it is not available at many of the centers, it is not widely studied technique at our areas. Heidelberg retinal flow meter is another technique which provides mean value of velocity, volume, and flow measurement from a software of 10 into 10 pixel box, but then it is a costly modality and not widely available. Now coming to two of the invasive tests, which are Torsion Angiography and Icg, which is in conjunction with scanning laser ophthalmoscopic technique. They give us arteriovenous pressure time and mean dye velocity. Now, assessment of both the bulk retinal flows can be done, and a retinal capillary perfusion can also be assessed by this technology. Now, similarly in ICG, it can also study the choroidal ocular blood flow, which is an important component of ocular blood flow. Now coming to optical coherence tomography and angiography OCTA, which has come up recently and which is a non-contact imaging technique. The best part is that it allows visualization of retinal and choroidal vasculature without the need to inject a dye. And it provides high resolution volumetric blood flow information. Important thing is that it detects the motion of red blood cells as intrinsic contrast and is sensitive to both transverse and axial flow time. Now, when we see the cross-sectional OCTA images, they can superimpose color-coded co-information, and therefore it is color-coded on the grayscale structure information, and therefore we can assess both the things, blood flow and retinal structural information, which can be presented together. Now, what are the advantages? It can be done very quickly. Various layers are imaged of the retina. Detailed evaluation, even in peripapillary area, can be assessed, and it generates quantitative data such as capillary perfusion density. Now, as I said, it is a non-invasive and no dye injection is required, but there are certain disadvantages with it, that it cannot differentiate between tissue loss and ischemia, and does not access vascular leakage as is seen with invasive technology. So there are few limitations of OCTA, and the rest of the things are good about this device. Now let's see how various layers are imaged in OCTA. Now the first photograph we can see here is the vitreous angiogram, where there is absence of any vascular flow. The second, here we can see this is superficial inner retinal angiogram, which shows normal retinal circulation, and at the center we can see this foveal avascular zone. Then this is the image which is of deep inner retinal angiogram, which shows deep retinal pulses. And this is the outer retinal slab, which shows, here we can see choroidal neovascularization. And this is the choriocapillary angiogram, and this is the infrastructural OCT. And here we can see CNV has been very nicely highlighted in this saliency-based approach. And then this is a composite angiogram, where we can see this inner retina, which is purple in color. And here we can see choroidal neovascular membrane very nicely highlighted in yellow. So there are various studies on glaucoma. The results of OCTA in glaucoma patients says that it can measure optic disc perfusion. It is useful in evaluation of glaucoma progression. and it demonstrates a reduced disc flow index and vessel density in glaucoma. And it also detects reduced optic nerve head blood flow density and is associated with structural and functional glaucomatous damage. So to summarize my talk, I would say there are multiple technologies which are available. Yes, this is the last slide. Thank you. There is no single vascular indicator that can completely evaluate ocular blood flow. Every technique has its own cons and pros, and these technologies are still evolving. But as of now, two modality, which is color Doppler and Octa, which can be utilized for measurement of ocular blood flow in our patients. Thank you so much for your kind attention.